Hi, welcome to the Visionary Women's Health Clinic TV. I'm Dr. Gay Weinstein. I'm here to help you better understand your woman's health and make sure that I give you the information that your doctor just may not have time to cover in detail. Today we're talking about fibroids. I get a lot of questions about fibroids, so we're going to talk about what they are, what kind of symptoms they can cause, and what you can do about them. Today we're talking about fibroids. So you went to see your doctor and they told you have fibroids, or maybe you have a friend that has fibroids, a family member that has fibroids, and you think, do you have fibroids? So let's talk about fibroids. Now, fibroids are very common in African American women, but also women of Arabic descent, and then we also tend to see it more in the minority communities. Now, this doesn't, of course, mean that Caucasian women don't get fibroids. I have a lot of Caucasian female patients who get big, large fibroids that have to get evaluated. So definitely don't rule that out as a possibility of what could be going on. So what are the symptoms that you may have if you have fibroids? The most common ones are going to be very heavy bleeding or very painful cycles. You may also notice that you, especially if the fibroids are very big, you may notice that you get a little bit more bloating, or that maybe you even feel something in your lower abdomen. If that's the case, definitely make an appointment with your gynecologist to see, do you have fibroids? Sometimes people have fibroids that sit in the cavity, and we're going to talk about the types of fibroids, and you may have trouble getting pregnant. And that's because that fibroid that's sitting in the cavity is interfering with the embryo's ability to stick on the wall. So sometimes infertility is the symptom that I find first in some of my patients with fibroids. So what are fibroids? I have a handy dandy little diagram for you. And so we're just going to take a look at this. So fibroids are basically benign growths of the uterus. So you'll see this here is the uterus. It's an amazing muscle that basically will carry a pregnancy. But this inner lining here is what we are shedding every single month, and that's coming out as your period. This is the fallopian tube that's going to carry this nice juicy egg down its tube into this cavity where a pregnancy occurs. And these are the ovaries, and this is the vaginal tissue. Fibroids come in different locations. So you see that some fibroids can hang off the uterus. If these get big, they can certainly push on other organs, and that can be problematic. Some fibroids sit inside the cavity, like I mentioned. We call those submucosal fibroids, and they generally will cause very heavy cycles and can interfere with pregnancy. If you are going to get IVF and you have one of these, the doctor is absolutely going to request that you get it removed before IVF is ever done. You also have some that sit in the wall. We call those intramural. Intramural fibroids can have a component that pushes inside the cavity. Intramural fibroids tend to cause pain, but if they push into the cavity, you may also get the heavy bleeding. And so this portion also may be requested to be taken out if you're trying to get pregnant. And then there are those that are called subserosal, meaning they just sit right under the skin of the uterus, and these can also get pretty big. And these tend to cause pain, bloating sensations, and if they get really big, you can definitely start to feel them. So those are the different types of fibroids. If you are diagnosed with a fibroid on ultrasound, make sure to ask your doctor, thank you for telling me this. Can you tell me what type of fibroid I have? Where are they located? Because this is going to matter in terms of what symptoms you may potentially develop, especially if you don't have any. So, what are the treatments for fibroids? All right, that's coming up next. So let's talk about your treatment options. Now, the first thing that should always be offered is a treatment for the symptoms. So if you're having heavy bleeding, you should definitely explore treatments for the heavy bleeding. If you're having one of those fibroids that sits in the cavity, the obvious answer, of course, is to go in and remove it. And your doctor can do that with something called a hysteroscopic myomectomy, where a tool is advanced inside of the uterus rather than cutting into your belly, and that fibroid is taken out. Make sure you go to a gynecologist that is very well versed with this type of procedure. And of course, if you're in Maryland, you can absolutely see me. I do hundreds of these. So taking that out if it's submucosal. If it's not submucosal, you don't necessarily have to get a hysterectomy or a myomectomy. There are medical treatments, whether they're oral medications, shots, different progesterone IUDs that you can be given that will control your pain and your bleeding. Now, of course, if they're really large and you do need surgery, there's always the abdominal myomectomy, which just means removal of just the fibroids, leaving the uterus behind, or a hysterectomy if you're done with childbearing. Now, I do want to mention a couple of other procedures that I find a lot of patients just don't know about. One of them is called a uterine artery embolization. This is done with an interventional radiologist, and they basically go in and they cut off the blood supply that's heading to the uterus, which means no blood supply for the fibroid. This is going to cause the fibroids to shrink, degenerate, and there you have no more symptoms. Now, not all types of fibroids are going to be eligible for this, so make sure that when you do bring this up with your doctor that you ask them, am I eligible for a uterine artery embolization? It's a quick procedure. You get to go home the same day, and you're not out for the 4 to 6 weeks that you would be out had you had a major surgery. There is an ultrasound-mediated treatment for fibroid that's also currently available with the company. It is a relatively new procedure, meaning that not a lot of gynecologists are using it yet, and so we still have to sort of watch and observe what the long-term effects are going to be. But essentially, this is an ultrasound that uses heat and the ultrasound technology to directly treat the fibroid by, again, going in through the cavity and then treating and targeting those fibroids if you wanted to avoid major surgery. So, as you can see, there are many things that can be done for your fibroid, and it is absolutely an option to do nothing. If you have no symptoms, you're not trying to conceive, and you feel fine, you do not have to do anything about your fibroids. But if you are having symptoms and you're having trouble or difficulty, talk to your gynecologist and see if they can offer anything that's going to work with your goals, your medical history, your lifestyle. If you have any questions, leave them in the comments. Don't forget to subscribe so that you can always get some new videos from the Visionary Women's Health TV. I'm here to talk about any of your women's health concerns. If you have topics that are on your mind, go ahead and put them in the comments as well. I actually would rather that all my followers tell me what they want to hear regarding women's health rather than rely on Google, because we know how that goes. So go ahead, feel free. I answer and respond to every single comment that I receive. So put them there and I will respond, and I'll make sure that your questions are going to be answered, and I will create a video to make sure that what's on your mind is also going to be answered. Subscribe, click the bell icon, hit the like so that more people can find this, more women can get the care that they need. All right, until next time.